Cool, we're live.
Yay.
See, it didn't even hurt.
No, ouch.
I'll just give it a minute or so, and then I'll do my intro, and then we can start with the questions. Oh, hello, Anne. I don't know. Did I say that Rita's might not make it tonight? Were you on already?
Yes. Yeah.
Yes.
Okay.
I
You
heard
see
that.
where my head is. I can't remember what I said 5 minutes ago.
This is going to go well. Yeah.
Yeah.
I have no idea. This is going to go. Oh, the other thing I did say to Sascha is sometimes my internet connection can be really dodgy. So if I disappear, just carry on. I'll just let myself back in again.
Right.
Don't be stressed.
Okay.
It happens all the time. All right. Okay. Yeah, we've got a couple of people that's joined us already. So, so it's Wednesday night. I'll just kick it off. It's Wednesday night. I'm flying solo tonight. The other auntie is supporting hubby who's getting his degree this evening. So, yeah, she's super proud, and she says she phoned me from the toilet a little while ago. She said, I don't think I'm going to make it. So it's just me. Annalise is on. Hi, Annalise. She did the kinesiology chat. Don't know if you guys saw that. Yes. And so let me kick off. You two are obviously family, if people didn't know that now or before. So we've got a bit of a powerhouse duo here this evening. I'll start with Dr. Loanne. Is a veterinary ophthalmologist. I always have to say that slowly. Veterinary ophthalmologist. So it's an eye doctor for dogs and cats and animals. And you work with horses and wildlife as well. Yes. And you are both based in Centurion, and Loanne, you also do a little, you come to Pretoria East as well once a week. Yes.
That is correct. Yes.
Yeah.
So I travel, go out to see my patients that can't come out to see me. That's what I do. Stare into beautiful animals' eyes most days.
Brilliant. Yeah. And then Sascha she writes often for the magazine, and I love the articles that she does. We need to do another one for cats. We haven't done cats for a while.
Yeah, we get carried away with dogs, don't we?
Yeah, we do get carried away with the dogs. And so Sascha has got a psychology degree, sociology, so she knows the human side of the animal behavior just as well, and started at Battersea Dogs and Cats in the UK. Vet nurse. Yeah, very, very accomplished, both ladies. So we're very honored to have both of you here. And we're kind of bringing together two topics that we won't necessarily in our minds think that it should go together, but we're talking about eyes and pain and how that affects behavior and how we can help pet parents through this process. So yay, well done. If I had a drum roll, I'd be doing a drum roll. Welcome.
Thank you. No, it's the same, like you're saying about the bringing two together. Even in human medicine, you see, it's like, oh, you're going to the doctor for pain, and no one, people that have like these chronic illnesses as well. It's like we need to put these two things together because they are together. They go hand in hand. Behavior affects pain, affects behavior. So it's definitely something that's together, basically.
Yeah, no, it's definitely, and we don't always think about it. I mean, I might revert back to this example a lot because the three of us worked together on Heidi. You remember Heidi that was picked up as a stray, and Loanne checked her eyes for us. And I think there's a couple of touch points there from the behavior point as well, where she was scared to move from outside inside and things like that. And the one thing that struck me about her was I didn't realize how blind, how little she could see. And you couldn't if you looked at her and you'd never seen her before, you wouldn't have
Yeah.
thought that this dog is
You wouldn't
blind.
say. Absolutely. Yeah,
Yeah.
she was relatively pain-free, and I think still is, around her eyes. But in terms of visual function, there's hardly anything. So it's just incredible how she manages with that. Yeah.
Yeah. And that it was a complete, you know, I'm still amazed. Like when I saw her at Valley Farm with you, you just, the way she moved and everything, you just didn't realize. And I think, you know, it kind of brings us into that question about pets are masters at hiding pain as well, you know, or discomfort.
Yes.
And maybe, Loan, if you could go through some subtle signs in the eyes, you know, maybe they squint or there's dullness, I don't know, you know, something that we might miss.
Yes.
You can maybe, you know, talk us about through those chronic pain signs.
Yeah, and exactly that. I think it's some form of innate, you know, sort of coping mechanism in most animals, to kind of just get on with it as much as possible. And yeah, I mean, the signs are often there, and they often are very, very subtle, and they can be easily overlooked. So some of the most common, you know, sort of telltale signs, and it's easy to look out for. And I know most pet parents are really diligent at, you know, sort of watching over their pets and caring for them well. But yeah, I'll just run through a couple of these points. So discharge, you know, sort of any form of and it would be abnormal, you know, if it's there and it's showing on the outer surface of the eye. A watery discharge. Sometimes it's a slightly thicker, mucousy discharge. Sometimes it's discolored. But yes, that is something to, you know, be taken seriously. Even a tiny amount that's present in only one eye, you know, and the other eye seemingly is fine. These are early warning signs, and intermittent as well. Sometimes these signs and symptoms can be so subtle because it's not always there. It's not consistently there, so comes and goes. So discharge is an easy one to look out for. It's on the outside of the eye. I think another easy one to spot that doesn't need a, you know, close-up detailed, you know, sort of investigation around the eye, blinking and squinting. You know, any form of even the mildest, you know, sort of sensitivity or discomfort. The function of the eyelids is to protect the eye. So it would function more, you know, there'd be an extra blink and a wink here and there. And once again, pay attention to one side more than the other. Often these painful conditions are unilateral, as we would call it. So may start with one eye and eventually affect the other, or only be present in one eye. So asymmetry with a lot of these symptoms are quite important. And then if you have an opportunity to look deeper or past those little eyelids, any color change is not normal. And anywhere, you know, on the eyeball, so this could be a bit of redness on the white of the eye. It could be a bit of redness that's seemingly on the surface of the eye or maybe inside the eye, haziness, cloudiness, even darker, you know, sort of pigmentary, you know, sort of discolorations. These are all telltale signs, you know, that something is not quite right in our animals' eyes. Yeah.
And what would you say? Would you first go to your general vet, or would you recommend that the pet parent makes an appointment with a ophthalmologist straight away?
You know, if one has access, you know, sort of to an ophthalmologist, that is by far, ideal. Because these signs and symptoms are so subtle, and they are, let's use the word non-specific. A bit of discharge could mean an ulcer, or it could mean high pressure, sort of within the eye. And it's quite important to discern between the two, and this often requires a bit of a detailed investigation with specialized, sort of tools and equipment. So if one has the opportunity and you're close by to an ophthalmologist, there aren't many of us in the country, unfortunately, but by all means, start with your ophthalmologist. If that's not possible, certainly seek the advice from your vet. Vets are trained and equipped with the basic, sort of ocular eye examination tools, and can make most of these diagnoses, sort of relatively easy. And most vets have access to advice from specialists, in most scenarios. So if in doubt, go and see your vet.
What do, in your experience, because you've been doing this for quite some time now, in South Africa, what do you find are the most common eye issues in pets?
Yeah, there's a few of them. But I think if we had to sort of pay specific attention to eye conditions where we've got this crossover or intersection with chronic pain and vision loss. This, I would say, is probably something like glaucoma or high pressure within the eyes. Very, very uncomfortable. I think it is one of the most, painful conditions for our animals to experience. It's something that we do see in humans as well. But what is often most frustrating and extremely devastating is the concurrent loss of vision, that goes with it as well. So losing vision while these eyes are, very uncomfortable and sore. I'd put that right up at the top of the list. It's a common problem that we see. Mostly our dog breeds are affected, and there are a few breeds that have possibly a genetic predisposition for this. And there are many presentations, sort of something like glaucoma. So most of those early subtle warning clinical signs that I've mentioned are these little signs that would come with something like glaucoma, a bit of discharge, bit of a sensitive eye. And because it's so uncomfortable with maybe very subtle outward signs, that could sometimes be coupled with a behavioral, sort of change as well.
Yeah, Sascha, do you maybe want to jump in here with from the behavior perspective and just maybe the impact on behavior?
Yeah, so just thinking about some of the cases that have come via, so I've seen them for behavior and then they've gone to Loanne, and it is because I've been in a consult and I'm like, I think there's something going on there. I think you need to go and see somebody. So we had, I was there, it wasn't my case, I was there with another behaviourist, and the dog was hand shy if you went to his head. He got aggressive, he snapped if you kind of went to pat him on the head. And while they were doing the consult, I'm just sitting here watching the dog, and like Loanne said, he was blinking like too much. And I think as a general owner, you probably wouldn't maybe not pick that up as being he's just sitting there. There was no kind of discharge. He just seemed to be blinking a whole lot more than he should. And the breed he was, it was typically a British Bulldog, so it was like, oh gosh, I'm sure this is because of your eyes. And it was. And he went to see Loanne, and yeah, it was a spastic entropia in your head in the end, wasn't it? Yeah. So yeah, and it's that basically your eyelashes, that bottom eyelid is constantly rubbing on your eye. So you think how we are when we get one eyelash in the eye. Can you imagine for months or years of your life, the whole bottom of your eyelashes are there just every day, just rubbing on your eye? So how uncomfortable. So no wonder if someone goes to touch you on your head and you're just sore on your face, you're like, please go away. And their way is aggression. So yeah, it's stuff like that you see, and it's the changes are so subtle in our animals, and we often as pet owners don't notice until there's a severe problem, unfortunately, because they can't communicate to us as well. So yeah, a lot of the time, and as well with the eyes, people, a limp, people often go to the vets for a limp. My animal's limping, I know that must be sore, so that's all good, let's go. But a bit of discharge, wake up, bit of a sticky eye, I'm sure he's fine, carry on. But yeah, yourself, when you have a scratch in your eye, something's gone in your eye, it is actually super, super painful. So they also must experience that as well. And they just can't say, look, my eye's really sore this morning. Can you go and have a look? So yeah, no, it's definitely you see, and with our pets, especially, well, the dogs, it's outwardly aggressive. Our cats, it might be a little bit more subtle, but yeah, it's often the kind of aggressive behaviors that we see, but also they can become very withdrawn, those kind of behaviors you see as well. So subtle changes, normally. So when, from the veterinary nurse perspective, you get a phone call for my animal doesn't seem quite right. I think she's okay, because I specialised in emergency and critical care. So it was like they'd call you in the middle of the night and be like, I don't think it's an emergency, but my cat's been doing this. And it's like, that's the significant, my cat, who normally doesn't like to be touched, is sitting on my lap. It's like, that's a problem. Yeah, there's a reason for that. Behaviour change, hiding. Cats love to hide. When they're not feeling very well, they go hide. They might be under the bed where they're not usually. Maybe they're very social. They go and sit quietly in the corner. He just thinks, oh, just having a bit of an off day. Probably not. Chances are no. And you'll get these animals that are coming to a hospital and they're really, really sick. And those signs have been so small. So yeah, any kind of behaviour change that is not normal needs to be kind of, that's why as behaviourists, it's always, have you had a vet check? Have you gone and made sure everything's okay? Because there's no point putting a behaviour plan in to change the way you feel about whatever we think is the problem, if actually you're just in pain, and we're gonna ignore that part because we're not addressing that part, we're not thinking about that, and we're going to try and change how you act, every day. If you're in pain, nothing's going to work. Yeah.
Correct.
Yeah, it's actually such a basic thing, going to the vet first before the behavior, but it's often the last thing that we think about is to actually just go and see the vet and just rule out the pain issue and make sure that's not the problem.
Yeah.
The other thing, I live with quite a few senior dogs, and a few of our seniors have passed along, and I have seen and noticed, obviously from a sound point of view, they're more sensitive to loud noises, where a dog before was never scared of thunder. All of a sudden, he's seeking comfort when there's thunder. But I've also noticed that they don't want to go outside for a pee in the dark at night. And I'm thinking, is this connected with the eyes? Can't they see? Are they struggling to see?
Right. That's an interesting point. Yeah. If we think about the function of vision in most of our animals, and we are talking specifically about dogs here, they are geared, if we look at the anatomical makeup of their retinas, they are geared for night vision. They have predominantly more rods in their retinas compared to cones. We are the other way around. So naturally, their night vision is superior to ours. So when we do see this subtle change of a little bit of night blindness, if we could call it that, in our dogs, it generally is quite significant. And often it points to a degenerative process, perhaps, that is going on in that retina. And because the rod population is the more predominant neuroreceptor, sort of in that retina, it would be the neuro cell type that would be affected first, with slow, low grade, possibly age-related degeneration. So night blindness would be that telltale sign of early or low grade retinal degeneration. Yeah.
Okay.
Sorry.
No, because at first I
Hopefully
thought,
not, though. Hopefully not. It may not be.
but with Boudica, I remember before she passed away, and I thought it was maybe her cognitive function has gone, she's gone down, because she would go outside and then she'll stand there and I'm thinking, okay, so she's like, thinking, why did I come outside? And then I remind her and pee, and then you can always see it go. But now having thought about the eye thing, because I see it in Fricky, the old boy that we rescued. I see it in him. He's becoming more reluctant to go outside, and he will come and I must go with him, so I must walk with him.
Right.
So that could, so I suppose maybe it is a bit a head thing as well, but maybe because he can't see that well anymore.
Coupled with that as well. It's a difficult one to sort of discern and assess definitively, without specialized and invasive, not quite invasive, but extensive, sort of retinal testing and that sort of thing. But something that we could maybe, try at home, just to test this theory, is this a night blindness, really going on? Maybe just change the condition and do a little obstacle course indoors, where one can control the light and the ambient intensity of the light, and maybe just rearrange the room, see what they do with the lights on, and then flip the lights off and watch the same reaction or response. So a noticeable difference in navigating an obstacle course under these different lighting intensities may confirm that possibly there is a definite night blindness, sort of playing a role here.
Okay, clever. Yeah, because they do, if going back to Heidi again, they do learn quite quickly their environment. So even though they cannot see, they navigate their environment without bumping into things.
Amazingly well. Yes. Yeah. It's incredible.
I've got my Mally, he's coming up a year now. So I got him because he was blind. We thought he was completely blind when I got him. And he did, when he first came to the home, he wouldn't, when a dog's looking at you, he wasn't like looking at me, he's looking past me. You could see he wasn't kind of making that connection to a person. And then there was very much day and night time with him. He couldn't tell where steps were and stuff. But now he's learnt the environment. He's looking at me, so there's definitely some vision there, but we're not sure how much yet. But nighttime, I forget because he just seems absolutely fine. I was at work and it was in the evening, and the electricity board was making a funny noise, so I went into the room without turning the light on, and he followed me in the room, and I was on the phone talking about the box, and I walked out and left him in the room completely empty, large room, nothing in there. I walked out and then got off the phone and I could hear him crying. He couldn't work out how to leave this room, and I was like, oh yes, you're blind, I forgot. Because you can't tell, you really can't tell at all. And it was because I went into that room, the lights were off, we don't normally go in that room, and he was completely like, I don't know how to get out of here, help me. So he can see normally as it seems that way, but it's only times like that where something's changed in the environment. He's like, well, I'm a bit lost here. And I'm like, oh yeah, sorry.
Yeah.
So yeah, they really do well, really well. That because their senses are so much stronger, their other senses than ours. You know, they don't rely on the vision as much. So yeah, they cope remarkably well.
We've got a question here from Sonia Briet. First of all, she said her first bull terrier had glaucoma and eventually had to put them to sleep as the pain couldn't be managed anymore. And then she goes on to ask, what would you suggest to use from an early age to promote good eye care?
I would say, yeah. I would say maybe do a bit of research, sort of into the breeds that you do have, and it's well documented for most breeds. Certain eye conditions that they may have a genetic predisposition to, and certainly bull terriers and most of our terriers, big and small, seemingly have quite a significant genetic predisposition to changes within the eye that predispose to either primary or secondary glaucoma. So perhaps just do a bit of research and just see what these predispositions are. And if it is something like glaucoma, the only way to intervene sooner rather than later is to do a bit of surveillance and monitoring. And this would take, a couple of regular checkups, sort of with your vet or preferably an ophthalmologist, just to assess the normal state of these eyes and closely watch for changes, sort of in trends, changes in pressure readings, changes in the internal dynamic within those eyes. As soon as those trends are noted, one can intervene with either medical management and now some of the newer surgical techniques that are available. And in most cases, if not all, the sooner one can get in there with some sort of management and prevention, the better the long term sort of prognosis might turn out to be. Unfortunately, with something like glaucoma, it's not something that we can change drastically. We can't change the outcome. So most of these eyes do go blind. Unfortunately, we always lose that battle. But if we can manage pain a bit more effectively and sooner, perhaps we can do much for quality of life and maybe just prolong that vision for as much as possible. So I would say, just to sum up again, do a bit of research, identify what these triggers are or what these predispositions are. And just look closely at these eyes. If at any stage one is unsure, ask a vet. Yeah.
And it's also, we go on a lot about ethical breeding, but most breeders will know what is a predisposed conditions in their breed, and they would test for that, and they wouldn't breed with dogs that are affected or that might be, or put carriers together. So it's important when you are doing your homework, and when you start approaching breeders, is to make sure that you check that the tests for that breed has been done and that they have done the eye tests as well. Yeah,
absolutely. Most breeders, and I'm hoping more of them would, just allow ophthalmologists to do screening, and this is with a hands-on physical examination of the eyes. So yes, we can do a lot of genetic testing, but I think combined with a physical examination, a clinical examination, just gives us so much more information and does help with this prudent selection at that critical, early breeding phases of breeding schemes. And that can go a long way in managing these and I would say mostly these vision threatening conditions that can be very painful. Yeah.
Got a question here for Annalise. It's a long one, so just bear with me when I read it all for you. I have a miniature pincher, and I rescued as a puppy. She ended up with idiopathic meningitis and other health issues. Over the course of a year, she began losing her sight. We did see an ophthalmologist. They said that she had uveitis, uveitis.
Uveitis, yeah. Close enough.
Thank you. and they couldn't see the retina. She's 3.5 years now and is basically blind, although it looks like she can see shades. Light affects her very much. She does get eye drops, and some days her eyes looks a bit sunken, and I always worry about pain. What would the signs be?
So uveitis, that's probably next to glaucoma. That would be the next, big condition that is quite sore. I think a different type of pain to a glaucoma pain or a pressure pain. This type of pain, I would imagine, produces more of a sharp light sensitivity, a photophobia. Sort of in these little eyes. So often with chronic and active uveitis, these individuals will show a bit of blepharospasm. This is that excessive blinking. Sometimes it's just easier to hold the eye closed. And even if only one eye is affected, often the other side will be closed as well, literally just in sympathy with what's happening on the other side. So hallmark sign for chronic uveitis would be light sensitivity, blinking, closed little eyes, a chronic watery discharge. There was a description there about a sunken looking little eye. The pain comes from a uveitis. Triggers a little muscle at the back of the eye, behind the eyeball. And as that little muscle contracts, it's a protective mechanism. It pulls the eye into the orbit and makes it look very deep set and sunken. It's a protective mechanism, but it's a sure indicator of pain as well and discomfort. So droopy looking eyes, closed little eyelids, watery discharge. If one can see the eyeball, there would be signs of inflammation as well. And that's often described as a bit of redness on the white of the eye, and then possibly a haze, a glazed look to the surface of the eye as well. And yes, unfortunately, with chronic uveitis, there's always this long-term risk for loss of vision. It's unfortunately, sort of one of the things that we try and treat actively to try and delay or prevent, sort of severe effects on vision.
Yeah, she just carries on to say that the ophthalmologist just said that there's nothing more they can do, and they also did not recommend removal of the eye or anything else. So, okay.
I mean, if there is still some form of vision sort of remaining in those eyes, I think it is worthwhile to try and manage the active uveitis. And there are various ways of doing this, with medical management, basically trial and error, sort of see what types of anti-inflammatories do work. Is it a combination of drops and sort of oral anti-inflammatories, and kind of just find the right, sort of balance that keeps everything nice and stable and keeps the little infant comfortable.
Mm.
If the pain is being adequately managed, and there is still a bit of vision left, then yes, I would reserve removal of the eyes as an absolute last resort.
Okay. Yeah, I think that answers Annalie's last comment where she says there's no discharge, no redness. The eyes looks like cataracts have also started to form. And then she says, how can I help with pain? Would eye removal be best? But I think you've answered that in the sense if there is some vision. Mm.
Yeah. Look, the presence of cataracts does indicate that this is maybe end stage, and that vision is mostly gone. And I would say if there are now behavioral changes that have come with possible an indication of low grade discomfort, then maybe just taking away the pain, which would be surgical removal. Then perhaps to perhaps consider that. Yeah.
Sure. Okay. That's a lot to think about.
We as humans find, and it's not nice, removal of the eye, quite traumatic. But sometimes, like Loanne was saying, when it gets to the point where we can't manage the pain anymore, the eye isn't doing its function. Actually, you are maybe doing a nice thing for your pet, although for us, it would be devastating to lose an eye. Actually, for them, because their other senses are so amazing as well. It's not the end of the world. Because pain is so important. Pain can change your life day to day. So if they are super uncomfortable, then it might be an option.
Sure. Yeah. And I suppose you'll look at the dog in its complete health. So if he's healthy in other areas of its body, and it's just the eye and the pain that's causing the behavior changes, etc., then yeah, she just says is why I'm asking about removal. I'd rather remove the pain. Yeah.
If you know you've covered, you've tried all avenues, like with the you're saying maybe not just eye drops, maybe an oral pain relief too. When you know you've exhausted everything, this is not an avenue for me. This is not. We're still in pain. Then it's definitely something to consider.
Absolutely.
Absolutely. Yeah. So I just want to ask you something. You sometimes see on social media blind dogs and they have these rings around them.
Yeah, they're halos. Yeah.
Yeah. Do we like them or don't we like them?
Yeah, I think most dogs don't need them, actually. And that's the thing. It was one of Loanne's clients a couple of weeks ago. Her dog, I recommended it to her. Normally I don't, because most dogs do adapt after a kind of, a month or two of vision loss. They're pretty much doing their own thing, and people have often spent a lot of money on, because they're not cheap. They spent some money on these things, and actually they don't use it. And so it's but this dog in particular had bumped into things at home a couple of times and hurt themselves. So now was really fearful about moving around the home. So and it's been going on for a while. So in those circumstances, let me gain some confidence back, because I know if I hit something, this piece of plastic in front of me is going to hit something first before then I do. But most dogs, because they cope so well, if you've got the money, go for it. But some people, they find that they're quite expensive and they don't want to spend that money. And I say, and Loanne probably agree with me as well. When the dog first loses its vision, we're often dealing a lot more with the human emotion side than we are the dog. It's often that's where the adjustments come in, and then when everything kind of the new normal becomes the new normal, things settle down, and then the dog's living their best life. As long as you've got your things covered, like your pool, or your hazards are under control, then the dog's normally fine. So if you can afford it, go for it, because it does give them that extra bit of confidence. But yeah, I find a lot of people don't really need them.
Yeah, because I suppose it's also then it's a second adjustment for the dog, because now it's got to get used to the halo as well as losing vision. And I mean, I suppose simple things could just be to like, don't move the furniture, you know, and keep the room so the dog learns quickly where everything is.
Yeah, and it's the really small things that we do and we don't realize, like your dining room table, your chairs. Maybe you'll sit down and then you'll get up and not push it back in, because you know, or take off my shoes and just leave them on the floor, which isn't a big, you know, you'll think about the big stuff. Let's not move the sofa. Let's not move this chair.
Yeah,
You know, so but it's those. I'll put my bag on the floor and the bag's not usually there, and the dog's just bang into the bag, and in those kind of things, they'll dent their confidence if all of a sudden there keeps being something in my way and it wasn't there before. They don't have the time to learn their environment and gain that confidence. So it's really the people to make sure they manage the environment, and if you can't do that across the house, then kind of have them a couple of rooms where you know you're going to leave your shoes outside, you're going to leave your bag outside, you're going to make sure in these rooms, so that you make sure that everything stays the same, especially at the beginning when we're trying to increase their confidence. We want them to move around freely, and that's what owners often see, is if they're worried, then they're not wanting to investigate. They're a bit nervous too, because I may hurt myself, so they're quite withdrawn, and then you're not seeing kind of the normal personality of your pet. So yeah, just try and manage your environment as best you can.
Yeah. So it's just like, how do you help the pet parent to kind of manage their expectations? You know, because they're also going through it is a big thing. You know, your dog is now blind. Potentially there could be pain, or it's affecting them, and and it's you know, how do you help them to manage expectations? You've got the psychology degree.
No. I think they are.
Sorry.
When they speak to each other. So do you remember there was? I'm sure, Loanne, you put one of your clients in touch with someone else, didn't you? Do you remember?
Correct.
Yeah, because there was one client that just couldn't cope with the fact that the eyes were going to be removed. Was it the eyes were going to be removed?
That's correct.
Go on. You carry on. I'll let you.
I'll just give you the medical background. So this poor little Staffy, completely blind by the stage with glaucoma, and really battling and struggling to control the pain. And so the only solution left for us was to have these eyes removed. And I'm going to hand over to you, Sash, to just connect with another pet parent that had been through the same process, perhaps a year or so before that. Just got them talking, really.
Yeah, that's it. So I think that's what you need. You need to see it's okay. There's someone else that's, you're back. We carried on talking. You're okay.
Well done.
No one noticed a thing. So I think you need to see it's okay. You know, that most of the time people need those stories. They need to hear from us. It's okay. We see this all the time. They do adjust. It's okay. And for those ones that don't adjust, these are our recommendations. And just some time. Give them some time. So it's. And there's a couple of, the first couple of visits, I think we normally find that they are kind of quite anxious, but then, you'll see them further down the line and everything's good.
Yeah. Oh, please. Okay. Adopting. Sometimes pets are surrendered because of their vision loss. What advice can you give to a pet parent that wants to adopt a blind dog, a puppy or an adult dog?
Yeah, I think I've done it myself recently in the last year. And I think I did that with confidence because I had a blind dog. I had a Bichon years ago, and she went blind at about 5. I rescued her from Battersea when she was 6 months old. She had neurological problems as well, and she went blind at about 5. It was cataract. Then we had the surgery, and then she regained her vision for about 5 years, and then she lost it again. And just knowing that, so she lasted until she was 13, so she lost her vision the first time at around 5, and knowing that she lived a healthy, fulfilled life, and just people need to see how amazingly well they do, and just that they can live a happy life, as long as the pain, the management is the eye condition is under control. Like you saw, and quite often when we're adopting animals, we don't realise that they, like with Heidi, we wouldn't have known how bad things were. And there's a lot of places that dogs go through the system and people don't realise that they've gone and they've been rehomed, and people don't realise that they have. So a completely blind dog, give them a chance. It'd be amazing. I remember in a shelter there was a dog, is a spaniel. The way this dog could catch a tennis ball, as soon as he heard that bounce, he knew, and he was completely blind, knew exactly where that ball was and would catch it every single time. It was fascinating to watch. So as long as you can make those minor adjustments at home, like the main thing is probably the pool safety is kind of your big one, and just kind of making sure that things are safe at home for a blind dog. They can live an amazing life.
They can still go out for walks and other social outings and things like that. Yeah,
absolutely. So sometimes again, it depends on their confidence. So my Mally pup is very nervous around other dogs. Even my dogs, when I first got him, it took him like 3 weeks before he would stay in the same room with them. So they would be all in the kitchen and he'd come down and then he'd run back upstairs again. So it depends again on the dog as to their confidence around. And I think breed type as well. He's a Mally, they're not that social most of the time anyway. So like off leash, I wouldn't let him in a park off leash in case he came to another dog. But my Bichon was fine with other dogs. I used to let her off leash. She'd go running and we'd do an emergency stop because sometimes I don't know what would go through her head. She was going straight and then all of a sudden there'd be a quick turn and I would just scream, stop, and she knew then I'm about to hit a tree, let me just stop her. And it was just scream, I'm going to stop. There were a few times where she misjudged the stuff and she did hit that tree, but most of the time she was fine. But so she had that freedom. She would go off leash, she would run as long it was somewhere where it was like an open field or a forest where I knew she couldn't do too bad, and she wouldn't go too far. She would run ahead, then stop, wait to hear those footsteps coming, and then she'd run ahead a bit further. So because she was fine, she was confident in herself. I knew that she wouldn't get, if another dog came up to her, she wouldn't startle because she was fine with them. So I think you judge that dog on what it can manage. For some it may be because they aren't so confident, you're worried about them getting lost or running off or anything. If they get a fright, then they would be on leash walking around. So just manage your dog as an individual, like with anything.
Yeah, I see Leanne says she's a blind dog mama. Yay. She says it's crazy how well she adapts to her surroundings, even though she's blind. She's a 14-year-old min pin. Her sense of smell is absolutely amazing, and she sniffs around to find me. Oh, that is so sweet.
Yeah, they are amazing. They're really amazing.
Incredible.
Yes, I just think, I suppose it's because we humanize the dogs, so we put our feelings onto them, and they're a little bit more just get on with stuff.
Absolutely.
than what we are.
Yes. And often if we can just deal with the pain side for them, sometimes they need a bit of help with that, but the rest they tend to just get on with and figure out. It's incredible.
Yeah.
Do you? Heidi's living her best life. Hey, do you hear? Have you heard an update from Heidi? Is she?
I haven't
I know
had
the
an
photos that
update
I've seen.
recently, but she was adopted and she's got a Ridgeback brother as well.
Sweet.
But I must actually check in with Lee and just see, because we did we made sure that she got the best food as well, species appropriate food, etc. And we did, Lee did say to the new owners that it would be good for her to kind of stay on that kind of a diet, a raw diet, so that there's not more, that she doesn't regress more. But last I heard, no, she was living her best life. So, and I must check in with the pups as well, because she had the 8 puppies with her.
Yes, yeah.
And I can't remember, Loan, if we said that, this is just mum's issue, or I can't remember if we said that it might come through in the pups later.
Yes, I think I've just got to think back clearly now. The consensus was that most of the changes in Heidi's eyes was what we would call congenital. So perhaps present from birth, but not necessarily genetic, if that makes sense. So something went wrong with Heidi as a little pup in her mom's tummy at a critical phase of her development. So yes, hopefully this is not gonna affect the pups. Yeah.
Yeah. I think the brilliance of your setup is that you've got the eye specialist, and to kind of see the pain, identify the pain or the condition, and then you've got the behavior specialist who will say, all right, now we know what the issue is, and now we can help you. And this is the great thing that I'm loving about the pet community, because everyone is kind of connected and have their part to play.
Definitely. In the overall health, it's about everything's got to be taken into consideration. It's not just the eye and that thing you're dealing with, it's the pain and how it affects them socially and stuff. It all goes hand in hand. Finally, we're getting somewhere. 20 years ago it was a bit different, but we're moving with the times.
No, we've seen a big change in obviously how we live with animals and how we interact with them, and then also from a behavior point of view, I think we're understanding a lot more, and the fact that pain can have such a significant impact on their behavior.
I think I spoke to you, Antonette, about it once. I think maybe I did. For pet owners, if you look at we use it in emergency medicine a lot, the feline grimace scale. So there's pictures.
Yes.
So we use it. So we used to have it on our hospital sheets in the emergency hospital, and just so you could make a note of the facial features of the cat. There are other species now, but at the time it was the cat, and just because the changes are so subtle, you have so it's good for pet owners to have a look and see how subtle the changes are, but these are the changes we're making when we're assessing whether the pain relief we're providing to our patient that's in hospital, whether it's good enough. And it is literally the where their whiskers are pointing that is telling us something, their ear position, their eyes, the shape of their eyes is so subtle. And if there's 5 different things you look at, but if you look at, there's like 3 pictures of a cat. If you looked at one of those pictures of the cat on its own, it would just look like a normal cat. It's only when you compare it to the other pictures that you're like, oh yeah, I can see the change. It is so subtle. So don't think your cat, it's got a bit of discharge, but it looks okay. It may not be, because if those differences are the whiskers, kind of straight out, are they kind of there, are they back flat against their face, all those kind of things. It's such small changes, and those are the kind of things your pet, just watch out for those changes, like the lady said about the eyes become sunken, as seeing that dog on the street, you probably wouldn't notice that, or going to adopt that dog from the shelter, it may just, you may think that's just the way that dog looks, but actually that's an indication that there's some pain there. Yeah.
Sure. We must you must send me the link for, if there's a link there for that.
I mean, I will. There's plenty of there's like drawings and pictures, but yeah, it's the feline grimace scale, or the feline grimace score. Some people call it.
I remember that. I remember. Then we will share that, because I think that would also give people a visual to kind of see. Oh wow, okay, this is it. Because I'm always mindful, like, when I do social media, pick images for social media, and I'm like, is this dog looking anxious, or what? This is apart from looking, okay, I can't use dogs with cropped ears, no, but all those things. But then you start looking at is this dog smiling, or is he panting, and is he anxious? What should I be using this photo? So it's like a whole new, it's like a TikTok's exercise. What can I use? What can I not use? But it's I think it's interesting if there's a scale like that where you can see the distinct differences next to each other. Then I think it's a lot more obvious than just looking at one image. Yeah.
Amazing.
All right.
Fascinating.
Yeah. Oh, we've almost gone an hour. Hey.
Oh, that went quickly, didn't it?
That did go really quick. And I think, I'm a little bit sad that Ria does not here, because I would have loved to explore more of the nutrition. And I don't know, Loan, did anything come with Dr. Anna?
Dr. Anna, no. So we just haven't been able to connect, and get some sort of flow going with analyzing all this data. Yes. She does have an impressive set of data that just needs to be analyzed, really. But that's it is something that I think is underexplored. The effects of nutrition on specifically eye conditions. We've seen it, and Sascha, I don't know if you remember Wilbur, English Bulldog. I think his name was Wilbur. Yeah.
No, Pablo.
Pablo, yes. There we go. One of the Bulldog names.
Yes.
Okay. Pablo, that's right. Chronic, sort of eye condition. I tried everything from topical medications to surgical correction of conformation around his eyelids, and multiple times. And eventually, for something totally unrelated, had a change in diet, and that fixed his eye problems. And I haven't seen him back in a few years, in fact. Oh, wow. So I think there is a very strong link between gut health, what we're feeding our dogs, overall general health, and I think sometimes the eyes on their own can be an indicator, sort of for some of these imbalances or abnormalities that comes mostly from diet. Yeah, it's amazing.
Yeah, I think we need to maybe come back to that one, and we'll ask Greta if she can get Dr. Anna on as well.
Yeah.
That'll be cool.
Really go in deep with that one. Yeah. Cool. Ladies, thank you so much. And thank you for holding the ship straight when I when I disappeared.
No one
it's all good to know. But it was brilliant. So I really enjoyed, and thank you very much for answering the questions as well. The recording will go onto YouTube probably tomorrow, and then people can rewatch it there. And if they have any more questions, they can send it to me, and I can forward it on to you guys. And I'm sure you will be able to answer some more questions. Great.
Definitely.
Exactly.
Thank you for having us. Thank you.
Thank you.
Oh, it was lovely to have you guys.
Awesome.
Thank you. Bye.
Bye. Bye-bye.